Dr. Anna Garrett, one of the co-founders of the Medipreneurs Summit, and I am here today with Dr. Bruce Berger, who is Professor Emeritus at Auburn University and President of Berger Consulting. And many of you may actually know Dr. Bruce Berger, as he is I call him the king of motivational interviewing. But he's going to be joining us at the Medipreneurs Summit this year, and we're really, really excited to have him. So welcome, Bruce.
Thank you. Look forward to it.
So tell us a little bit about what you're doing now, since you are Professor Emeritus. So where has your path led you after your tenure at Auburn?
I am focused exclusively on training people in motivational interviewing, doing research in motivational interviewing, and continuing to develop it so that healthcare professionals can use it in a time-limited environment.
So you're going to be speaking, the title of your topic actually is Beyond the Acronym, Getting to Better Patient Adherence and Outcomes. Tell us a little bit about why beyond the acronym.
Well, when William Miller, the clinical psychologist who developed MI, developed it, it was developed for clinical psychologists. And he developed a lot of acronyms, READS, ORS, DARN, etc. Now, clinical psychologists understood what all those letters meant very quickly. For example, there's a D that stands for developed discrepancy, and it's about cognitive dissonance. That's just not part of our training. And what we found after 20 years of training using Miller's approach, that healthcare professionals, couldn't remember the acronyms. If they remembered the acronyms, they couldn't remember what the letters stood for. If they remembered what the letters stood for, they weren't sure when to use them. And it really got in the way of them being able to use motivational interviewing. And so we developed what is called a sense-making approach that's based upon the work of a woman named Brenda Dervin, who basically said that we're sense makers, and patients make sense of their illness, they make sense of the treatment, and they make sense of their relationship with their healthcare professional. And oftentimes, when people are ambivalent or resistant to change, which is who MI was developed for, their sense making is either missing information or has inaccurate information, which causes them to basically opt out. And so we've really focused what we're trying to do on listening to how the patient's making sense.
So, you know, if someone is a busy pharmacist, let's say in a retail setting, how can they quickly work this into their workflow to get better patient adherence and outcomes?
Well, our approach is based upon what's called brief motivational interviewing, which is really targeted at 3 to 5 minute interactions. Now, I'm not going to kid anybody. If you've got a new patient that's newly diagnosed with high blood pressure, diabetes, etc., you are not going to be effective in 30 seconds. It really, you know, we divide it into two different aspects. One, talking to patients who are newly diagnosed, and how do you assess whether there may be adherence problems using MI? And then talking to patients who have been on medicine for a long time and they're now having adherence problems. How do you begin to mine down in terms of what the problems are? You know, so when you encounter a potential adherence problem or one that actually exists, you need 3 to 5 minutes in our approach to really begin to mine down and really begin to ask the patient to reconsider.
Right.
After that, the sessions can be even shorter, but we think 3 to 5 minutes is a realistic amount of time for a pharmacist to at least initially spend with a patient to begin to understand what the issues are.
Right. So what would one of our Medipreneurs attendees gain from attending your session?
I would say that there's lots of research, and we've done some of it, to show that MI is extremely effective at improving adherence and outcomes. And you know, given star ratings, I realize that pharmacies are not directly being star rated, but on the other hand, they're working with insurance plans that are looking for preferred providers, and as a result of patient satisfaction, better health outcomes, etc. And so for somebody who's wanting to become a preferred provider, MI can help them do a much better job of addressing adherence issues. One of the things that we know is that MTM, of course, has exploded in the last several years, but the research shows that it's relatively ineffective. And my contention is that we've never still taught people, now that you've identified adherence problems, how do we talk to this patient about this in a way that doesn't put them off?
Right.
So,
well, and I, you know, as somebody who does coaching in her practice, I know what a challenge it is, and I have all the time in the world to spend with my clients. So, and it's still challenging, even if I have that much time.
yeah.
So,
Well, and I talked to an MTM exec the other day, and he said the number one problem or factor that is contributing to non-adherence, he said, are patient factors. You know, like forgetfulness, or they can't afford the copay, or resources like being able to get there, or what they know about the medication and the illness. And I said to him, no, the number one factor is the way we respond to patients. Because every patient's going to have some issue. You know, I can't lose weight. I've tried, I've done it before, and I gain it back, so I'm discouraged. They're not the problem. The problem is, how do we respond to that patient's discouragement?
right.
Do we do so in a way that now explores that with them and finds out what they can do, or do we beat them over the head about it and say, but you still need to lose weight?
Exactly. Couldn't agree more.
Yeah.
Well, I'm excited to have you join us in Asheville, and can't wait to hear what you have to say and what you share with our participants to really help bring their patient interaction skills along, because it's so important no matter what practice setting you're in.
I couldn't agree more.
So we will look forward to seeing you in April.
Sounds great. I look forward to it.
All right, great. Thank